What are the indications for IVF? Now, the indications for IVF can be broadly classified into indications in the female, indications in the male. It could be combined indications, and it could be for indications in neither of the two. Now, the most common indications in the female are badly damaged tubes, endometriosis, polycystic ovarian disease, and in females who have a decreased egg count, or in females whose egg count has been exhausted, that we call as ovarian insufficiency or ovarian failure. Now, indications for the male can be broadly classified into the male factor infertility. Common indications are the count could be very less than 10 million, motility could be less than 30 million, and there could be large number of morphologically abnormal sperms. Apart from this, in the males, IVF is indicated in those males whose sperm count is absolutely zero. In these cases, we directly aspirate the sperm from the epididymis or the testis by different microsurgical techniques, and we harvest the sperms from that technique and inject into the egg by ICSI and fertilize those eggs with the husband's sperm. Apart from this, there are very few indications or rare indications in the males where IVF is indicated, especially in the males who are scheduled to go for chemotherapy or radiotherapy or surgery, especially for testicular tumors. Combined indications, like there is a defect or the problem in the male and in the female. Like the female could be having a badly damaged tubes. Apart from that, the male could be having a low sperm count. So these are the combined indications. Or the female could be having polycystic ovarian disease and the male could be having azoospermia. When the male is diagnosed to have azoospermia, in those cases, we physically examine the male. We see whether the sperms are being produced in the testes, and if they are being produced, then sperms can be retrieved from the testes and the husband can have his own genetic child. Only in very few cases, especially what we call as testicular failure, in those cases the testes are very small, they are very soft, and sometimes the testes could be undescended also. And in those cases, we may have to require a donor semen for IVF. The last indication, there could be no defect in either of the partner. Means there are three basic parameters required to have a healthy pregnancy. The female should be ovulating at regular intervals. She should have a sufficient egg count. Either single fallopian tube has to be patent, and a husband's semen report is normal. When all the three reports are normal, still the couple is not able to conceive, we classify them as unexplained infertility. So when the couples of unexplained infertility come to the clinic, they have already had multiple cycles of ovulation induction, some 3 to 6 cycles of IUI.